The AUTO1 study is a really exciting study for us at UCL, and particularly for adult hematologists like me. So I deal with a lot of patients who have acute lymphoblastic leukemia that's relapsed, and we have very few treatment options for these patients. But we know they're a very vulnerable group of patients who can't tolerate the more severe toxicities that we see with some treatments. So AUTO1 is actually addressing some of those major concerns we have, because it's a CAR-T cell targeting CD19, which, as we know, is expressed on malignant B cells. And the binding kinetic of this CAR is different to conventional CARs, and it's in contact with its target for lesser time. And what that means is that, per contact with cell, it secretes less cytokines and creates less of a cytokine-release. And as we know, that's one of the biggest risks to our patients from CAR-T cell therapy. And we've been testing it in adult patients at UCL, and we've noticed that cytokine-release syndrome, the high grades, are not observed with this product, and this is totally different to what's been described in the literature. And of course, our patients are getting great responses to this treatment as well. So despite the fact that they're not getting the sort of higher grade toxicities, they're still achieving molecularly negative disease responses. So as far as a kind of a compelling therapy for ALL is concerned, I mean, it's really, it's been great to sort of bring this right the way from the bench to the bedside. And the good thing about this CAR as well, and probably by virtue of the fact that it has this sort of slightly different binding kinetic, it means that it persists in the patients for a long time. And you may argue, well, why is that important? Well, we know it's important for acute lymphoblastic leukemia. We know that at any time the leukemic stem cells can re-emerge following treatment and can repopulate the leukemia blast population. So we need some kind of therapy that is in the patient's system, that is persisting, forming part of their immune system to help in an ongoing way to reject the tumour. And that's what we've seen with this AUTO1. We've seen that it persists, certainly at the 12-month time point in our patients. So we feel it's good for treating the disease, minimal toxicity, and also it has that persistence element that might lead to long-term disease control. So it's been a great project to be involved in.